Good evening. My paper is a comparative study on the effect of dorzolamide versus timolol on ocular blood flow in patients with normal tensive glaucoma. Glaucoma is a condition characterized by progressive retinal ganglion cell death and associated visual field loss. Elevated intraocular pressure is not the only risk factor. Other causes like ischemia to the optic nerve and dysfunctional vascular regulation can also cause a progression in glaucoma. In normal tension glaucoma, the IOP independent factors predominate for the progression of glaucoma. It's not moving, sir. This is a typical picture of an optic nerve with a superior rim loss with a corresponding field defect. In 2007, the World Glaucoma Consensus have reported that a lower ocular perfusion pressure, a lower ocular blood flow and a vascular dysregulation can cause progression in glaucoma. And ever since then, there are a lot of literature evidence which says that the retrobulbar vasculature is an important parameter in the progression of glaucoma, and assessment of retrobulbar parameters can be assessed by the color Doppler imaging, and recent evidences from literature says it can be linked with glaucoma progression and visual field loss. It has been hypothesized that dorzolamide increases ocular blood flow and it can be studied by color Doppler imaging. Color Doppler imaging can be studied by GE Sono CT ultrasound system with a 7.5 MHz linear probe. And in color Doppler imaging, we measure the velocities in the ophthalmic artery, central retinal artery and short posterior ciliary artery, which are the main vessels which are responsible for the ischemia to the nerves. So once the velocities are calculated, the machine gives us the resistive index. This is the machine, color Doppler machine, and this is the reporting from the machine. We get the peak systolic velocity and end systolic velocity. We did a small sample to determine the normative data from our population, and we found that there was an increase in resistive index with age. This is a normative pattern with a peak and a trough of a color Doppler imaging, and this is a picture of a glaucomatous patient with a flattening of the peaking. So with the basic background in mind, we decided to do a study to find the effect of dorzolamide and timolol on ocular blood flow using color Doppler imaging in normal tensive glaucoma patients. It was a prospective study. We included newly diagnosed mild to moderate normotensive glaucoma patients. We did a baseline glaucoma testing and a color Doppler imaging. The patients were randomized into dorzolamide and timolol group, and they were given medicines for a period of 12 weeks. And repeat color Doppler imaging was done after 12 weeks. Glaucoma evaluation and ocular blood flow was analyzed post-treatment also. We included, as I told, we included mild to moderate normotensive patients with a best corrected visual acuity of 20/40 and who were willing for follow-up. We excluded patients with all types of other glaucomas and with other systemic disorders with current use of steroid use. During the initial visit, we measured the pulse rate, we calculated the OPP with the BP and the pulse rate, and we did a slit lamp evaluation, gonioscope evaluation, fundus evaluation, field evaluation. Intraocular pressure was measured, and we did a color Doppler imaging as a baseline. And then the patient, once the patient was diagnosed to have normal tension glaucoma, the patients were taken the color Doppler imaging, and every alternate patient was given timolol. Final measurement was taken after 12 weeks. So basically the study patients were divided into two groups, timolol group and dorzolamide group. The baseline CDA measurements were taken and CDA were taken after treatment. So we had 11 patients in each group, and in our study, we did not find any significant decrease in the resistive index in the dorzolamide group and timolol group in ophthalmic artery and central retinal artery. However, in short posterior ciliary artery, we found that there was a significant reduction in resistive index in the dorzolamide group. Coming on to the vascularization of the outer retina, it is mainly by the posterior ciliary artery, and posterior ciliary artery plays a very important role in the progression of glaucoma. Ischemia to the PCA causes progression of glaucoma, and analysis of the velocity of posterior ciliary artery can give a clue for the progression of glaucoma. But it requires a little skill as the vessel is little small compared to ophthalmic artery and central retinal artery. literature says that a decrease in ocular perfusion pressure and an increase in resistive index can cause progression in glaucoma, and color Doppler imaging can be one of the prognosticative marker. And Kaiser et al. Have reported that normal tension glaucoma is mainly determined by the retrobulbar hemodynamics. 72% of the literature says that dorzolamide increases ocular blood flow by extracellular acidosis and selective inhibition of CAI inhibitor. However, our data did not show a significant reduction in resistive index in the ophthalmic artery and central retinal artery, but it showed a significant reduction in resistive index in short posterior ciliary artery. Rankin et al. Also showed a similar result like our study. However, our study was had a small sample and had a very short follow-up. So to conclude, perfusion of the optic nerve head is directly related to retrobulbar circulation, and resistive index can be a prognosticative marker in uncontrolled glaucoma and normal tension glaucoma. Thank you.
Thank you very much. Thank you.